Chapter 13, Nervous System, Brain, and Cranial Nerves. So, moving on to the pons. The pons is inferior to the midbrain. The pons has many sensory and motor tracts passing through it, not a surprise. And it also has a very large middle cerebellar peduncles. So the pons has the largest connection to the cerebellum. So most information and commands going from and to the cerebellum pass through the pons. If you look inside the pons, you see that it has the pontine respiratory center. Pontine respiratory center helps to regulate the skeletal muscles of breathing, basically to make sure that we don't overinflate our lungs. Nobody wants to damage the lungs by breathing in too deeply. It also has the superior olivary complex. That is involved in pathway for sound localization, so it helps us know where a sound came from. And it has the origins for a variety of cranial nerves, including the trigeminal nerve, the abducens nerve, the facial nerve, and the vestibulocochlear nerve. So those four nerves originate in the pons. Then we have the medulla oblongata. It is inferior to the pons, and it connects to the spinal cord and is actually continuous with the spinal cord. And all tracks between the brain and the spinal cord must pass through the medulla oblongata. The medulla oblongata has two anterior ridges called pyramids. The pyramids are long, bulging structures that house most of the motor tracts coming from the primary motor area of the cerebrum. So it has the tracts that control many skeletal muscles. And within the pyramids, we have what's referred to as the decussation of the pyramids, where the commands from the right side of the brain go to the left side of the body, and the left side of the brain go to the right side of the body. The medulla oblongata also has two lateral bulges called the olives. They are relay places for ascending sensory impulses to the cerebellum. So if information is going from the body to the cerebellum, it has to pass through the olives of the medulla oblongata. And then there's also the inferior cerebellar peduncles, a small connection connecting the medulla oblongata to the cerebellum, where obviously that sensory information is passing through. Also found in the medulla oblongata is the cardiac center. The cardiac center helps to regulate the heart's rate and the strength of the heart's contractions. It doesn't cause the heart to beat, it controls how fast and how powerfully it beats. And then there's also the vasomotor center. Vasomotor center controls blood pressure. It does this by controlling the diameter of blood vessels, especially the diameters of arterioles, which are tiny blood vessels. They increase blood pressure by constricting or decreasing the diameter of the arterioles. It decreases blood pressure by relaxing or increasing the diameter of the arterioles. There's also the medullary respiratory center. The medullary respiratory center helps to signal inhalation. So it regulates and initiates respiration. So it tells those muscles like the diaphragm to contract to allow expansion of the lungs and air to enter the lungs. And this is, of course, influenced by the pontine's respiratory center so that we don't overinflate. There are other nuclei, various nuclei within the medulla oblongata involved in things like for coughing, sneezing, salivating, swallowing, gagging, vomiting, lots of visceral reflexes that occur that sometimes we don't want to have occur. And then finally, there are a number of cranial nerves whose nuclei, whose origin is found in the medulla oblongata, including the vestibulocochlear nerve, the glossopharyngeal nerve, the vagus nerve, the accessory nerve, and the hypoglossal nerve. We'll note that the vestibulocochlear nerve has an origin and nuclei in both the pons and the medulla oblongata. Moving on to the cerebellum. Here's an image from Powerpuff Girls. In the Powerpuff Girls, the mayor had a secretary, and her name was Cerebellum. Basically, she was the brain of the mare. All right, in reality, cerebellum is the second largest part of the brain. It has two hemispheres, a right and left hemisphere. It helps to produce fine control over motor actions, so our motions are smooth and well regulated, and we're doing the things we want to do. And it is also involved in storing memories related to movement patterns, such as playing scales on a piano. The cerebellum has two hemispheres, a right hemisphere and a left hemisphere. It also has a structure down the middle connecting the hemispheres called the vermis. And then the folds seen on the surface of the cerebellum are referred to as folia. So instead of gyruses, they're called folia. The cerebellum has a few internal structures. It has a cerebellar cortex. It's equivalent of the cerebral cortex. And the cerebellar cortex, again, is composed primarily of gray matter. And then it has an internal white matter structure. And that white matter structure is called the arborvitae. It's called the arborvitae because people thought it looked kind of like a branching tree. And then there are some additional smaller cerebellar nuclei within the white matter. The cerebellum is able to connect to both the midbrain via the superior cerebellar peduncles, to the pons via the middle cerebellar peduncles, and to the medulla oblongata via the inferior cerebellar peduncles. And again, the function of the cerebellum is to help fine-tune and control skeletal muscle movements. So it coordinates and fine-tunes skeletal muscle movements. It ensures that skeletal muscles follow the correct pattern of movement. It stores memories about previously learned movements, such as scales on a piano. And it also adjusts movements that are initiated by the cerebrum to ensure that our movements are nice and smooth and well regulated. The cerebellum also helps maintain equilibrium and posture, so it helps control skeletal muscles in an involuntary manner. So we're not consciously aware of our muscles in our back that are contracting for our posture, but they are occurring. The cerebellum also receives proprioceptive information about the stretch and location of muscles and joints, and this gives us an overall unconscious awareness of the body's position and the tone of the muscles. It is also receiving input from sensory and motor pathways all the time. As you can see, sensory information goes straight into the cerebellum via the medulla oblongata, and it's also receiving information about what's going on in terms of motor commands to the skeletal muscles, and it's also sending information out to affect what the primary motor cortex is doing. And finally, it monitors muscular activities. It basically is doing an error correction function. So it knows what it is we're trying to do in a motion, is aware of what the emotion that is actually occurring, and then it alters that motion so that we are actually doing what we want to do. So it's a manager managing the motions that are being commanded by the primary motor cortex. So the cerebellum is one of the parts of the brain that get affected by alcohol and other drugs. And when you have impaired cerebellar function, you can develop what's known as ataxia. Ataxia is basically when a really drunk person has trouble walking, so a disturbance in their gait, have trouble with their posture and balance, so they can fall down easily, and basically they're having trouble knowing where exactly their body parts are. So they're having some inhibition to their proprioceptive sensations. So for instance, someone with ataxia, if they closed their eyes, they would be unable to touch their nose with their finger. Now, ataxia can also be caused by actual damage to the cerebellum and to a few other parts of the brain. So it doesn't only occur when someone is drunk, it also can occur from actual injury. And in that case, then it would be permanent. All right, the limbic system. We've mentioned the limbic system a little bit. It is the system around motions, processing and experiencing emotions. It is composed of multiple structures, both in the cerebrum and the diencephalon, so structures sort of on the border between the cerebrum and diencephalon, and sort of forms a ring around the diencephalon. One important structure is the hippocampus. The hippocampus is important in storing memories and in forming long-term memories. It's also included is the amygdaloid body. The amygdaloid body is involved in several aspects of emotion, especially anger and fear, and it can help store memories related to being scared or upset. Also, it turns out, part of the limbic system includes the olfactory bulb, olfactory tract, and olfactory cortex. So smell apparently is very tightly linked to emotions, so odors can evoke emotional responses and memories. All right, moving on to the reticular formation. Reticular formation is sort of a broad, vague structure that is diffuse and projects through the center, the core of the medulla oblongata, the pons, and the midbrain, and then reaches out and has impacts on a lot of other structures in the brain. It has a motor component, so it helps to regulate muscle tone in various skeletal muscles and also assists in autonomic motor functions such as heart rate. And it has a sensory component, often called the reticular activating system. This sensory component helps to process visual, auditory, and touch stimuli and helps to also keep us alert. So it uses the information so we're alert, we're aware of what's going on around us at some level, whether it's conscious or not. And this sensory component, the reticular activating system, is not active when we're asleep. Part of the reason why we're not so aware of what's going on around us when we're asleep. Again, this is sort of a more vague, diffuse structure. It is also thought to be linked to consciousness, so that when we have this awareness of sensations externally, it allows us to be awake, asleep, alert, half asleep, drowsy, dozing off. So it is able to stimulate and regulate some large regions of the cortex to basically help control how aware we are of the world around us. So it is obviously depressed and relatively inactive when we're asleep, more inactive when we're awake, but if you're half asleep, then it's somewhat depressed. If you're zoning out, it's not as active, but when you're really alert at what's going on, it is very active. All right, some states of unconsciousness. We have fainting. Fainting is a brief loss of consciousness, often when there's inadequate blood flow or low blood pressure to parts of the cerebrum. The person faints. I know people who can faint from seeing things like videos of surgery. There's stupor. Stupor is different. It is when someone is not asleep, they're even in a deeper state where they're only aroused by extreme stimuli. So you have to like smack them around really hard to get them to go, oh, and then they'll probably fall back into their stupor. It can be caused by metabolic disorders, damage or disease to liver and kidneys, brain trauma, drugs. Then there's a coma. A coma is a deep and profound unconsciousness. They are alive but unable to respond to the environment around them. It can be caused by lots of things, including head, brain injuries, low blood sugar, drugs. So a coma is a state that lacks both awareness and wakefulness. And then there's persistent vegetative state, which is different. The person is not thinking, is not aware of their environment, but they do have some non-cognitive brain functions occurring. They do have a sleep-wake cycle, even though they're not conscious. And there is possibility for them to have some spontaneous movements, even though they are not responding to their environment. So patients in a vegetative state may have awoken from a coma, but still have not regained awareness.